there. Welcome back to the Made to Mom podcast. I'm your host, Dr. Alexia Priolo, naturopathic doctor. And on today's episode, I'll be discussing breech babies and the techniques you may consider using to help optimize an optimal fetal positioning and to help increase baby's chances of turning. Now, a breech presentation where a baby's buttocks are down is common in the second trimester of pregnancy. Typically, most babies will turn into a head down or cephalic position before birth, but this doesn't always happen. By full term, between 3 to 4% of babies are breech, and this might result in a cesarean birth. Now, before we get into what can we possibly done to encourage baby to turn, let's talk about the four types of breech presentation. First, we have a complete breech where both of the baby's knees are bent and their feet and buttocks are closest to the birth canal. An incomplete breech is when one of the baby's knees is bent and their foot and buttocks are closest to the birth canal. The third situation is a frank breech, where the baby's legs are folded flat against their head and their buttocks is closest to the birth canal. And the fourth is a footling breech, where one or both feet are presenting first to the birth canal. Now, a breech presentation doesn't always happen, but there are certain situations that might increase its risk. Now, when someone is between 32 to 36 weeks gestation, the risk of breech includes preterm premature rupture of the membranes, low levels of amniotic fluid, a maternal age over 35, a first time pregnancy, a previous C section, fetal weight below the 10th percentile of female sex, and fetal congenital anomalies. After someone is 37 weeks gestation, the risk of breech includes premature rupture of the membranes, low levels of amniotic fluid, maternal age over 35, a first time pregnancy, previous C section, maternal hypothyroidism, pregestational diabetes, placenta covering or near or over the cervix, a fetal weight below the 10th percentile, female sex, and fetal congenital anomalies. Now, during your routine prenatal appointments with your OB or midwife, they'll touch your abdomen to feel for baby's head, back, and buttocks just to determine where they are. If they suspect that your baby is breech, then you'll likely be sent for an ultrasound to go ahead and confirm this. While your baby will usually get into a proper birthing position towards the end of pregnancy, as I mentioned before, this doesn't always happen. So, your care provider may recommend complementary therapies to help promote optimal fetal positioning before recommending an external cephalic version, which I'll refer to as an ECV going forward, or sometimes they'll go straight to recommending a cesarean birth. An ECV is where an obstetrician and sometimes a midwife, but not always, will manually attempt to turn the baby in the hopes that they will turn into a head down position. An ultrasound is used to help guide the turning, and fetal monitoring is performed before and after the procedure. Now, complications during an ECV include premature rupture of the membranes, changes in the fetal heart rate, placental abruption, and preterm labor. Not everyone is offered an ECV though, and it may not be attempted when you have pregnancy of multiples. There are concerns about fetal health. You have certain abnormalities of the reproductive system, and the placenta is in the wrong place, or it's come away from the wall of the uterus. Now, you might be wondering about a vaginal breech delivery, which, to be honest, is quite rare. A number of serious complications exist that include traumatic injuries and oxygen deprivation of the fetus. Fetal death is 4 times higher with a vaginal breech compared to a head down delivery. And because of this, a cesarean birth, otherwise known as a C section, is typically recommended. There are some treatments that can be done in your naturopathic doctor's office or at home to help promote optimal fetal positioning. Studies show that acupuncture type interventions, including moxibustion, can go ahead and increase the presentation of cephalic presentation at birth. Moxibustion is a traditional Chinese medicine technique that uses the heat generated from a lit moxibustion stick to stimulate acupoints. Hold on, let me get my stick and show you. This is a moxibustion stick. So typically during a treatment, what I would do is light it up, which basically involves me holding it towards a candle. And so the tip will light, it will turn orange and then white as more ash presents. So essentially, what I would do during an acupuncture treatment, if you can imagine, this is my foot. At the bottom corner of the pinky toe is an acupuncture point called urinary bladder 67. And essentially, I will hold this lit stick to an acupuncture needle here for about 20 minutes, and I'll alternate between both sides. This moxibustion stick will cause a warming sensation to the toe, and pregnant people might experience increased fetal movements throughout the treatment. At the end of the treatment, the naturopathic doctor may have you continue this treatment at home for a number of days. Now, moxa is contraindicated in some of the situations like uterine and or placental abnormalities, multiple gestation, single or double footling breech, vaginal bleeding, ruptured membranes, and hypertensive disorders of pregnancy like preeclampsia. Lastly, postural techniques have also been studied, and one study demonstrated that if pregnant women laid on their side a few times per day, it would help result in a cephalic presentation. In this situation, if the fetal back was on the left side, the pregnant person would lay on her right side, and vice versa. The limitation to this particular study, though, was that it was done in women between 28 weeks gestation and 29 weeks and 6 days of gestation, so not later on in pregnancy. And this is often when I personally encounter pregnant people with a breech presentation. Thank you so much for listening to this episode about the breech presentation. I do hope you found it informative. If you've been pregnant, was your baby breech at any point during pregnancy? Did you try acupuncture or moxibustion? Let us know in the comments. And if you found this episode helpful, please subscribe to this podcast, follow me on Instagram, and potentially leave a review. I'll talk to you next time. Take care.